Temporomandibular joint is simply called the TMJ. It is formed by the articulation of the mandible and the temporal bone of the cranium. It is located anteriorly to the tragus of the ear on the lateral aspect of the face. Let's talk about the articulating surfaces. The TMJ consists of articulations between three surfaces. There are the mandibular fossa, articular tubercle from the squamous part of the temporal bone, and the head of the mandible. This joint has a special mechanism. This unique mechanism is that the articular surface of the bones never come into contact with each other. They are separated by an articular disc. The presence of such a disc splits the joint into two synovial joint cavities, each lined by the synovial membrane. The articular surface of the bones are covered by the fibrocartilage, not hyaline cartilage. Let's have a look at the various ligaments that brings about stability to this joint. There are three extracapsular ligaments seen in the joint. There are the lateral ligament, the sphenomandibular ligament, and the stylomandibular ligament. The lateral ligament runs from the beginning of the articular tubule of the mandibular neck. It is thickening of the joint capsule and it acts to prevent the posterior dislocation of the joint. Sphenomandibular ligament originates from the sphenoid spine and it attaches to the mandible. Finally, the stylomandibular ligament. It is a thickening of the fascia of the parotid gland. Along with the facial muscles, it supports the weight of the jaw. Let's talk about the different movements that occur at this joint. Movements at this joint are produced by the muscles of mastication and the hyoid muscles. We are going to discuss these movements of the TMJ joint into two main categories. We have protrusion and retraction, and we also have elevation and depression movement. Firstly, the protrusion and retraction. The upper part of the TMJ allows protrusion and retraction of the bone. This protrusion and retraction of the mandible is simply the anterior and the posterior movement of the jaw. The muscle responsible for protrusion movement is the lateral pterygoid muscle, while the posterior fibers of the temporalis muscle perform retraction. Chewing and grinding, which is a lateral movement, is achieved by alternately protruding and retracting the mandible on each side. So let's look at the other two groups of movement, which is elevation and depression. The lower part of the joint permits elevation and depression of the mandible, that is, opening and closing of the mouth. Depression is mostly caused by gravity, although if there is resistance, the digastric, the genoid, and the mylohyoid muscle assist. Elevation is a very strong movement that is caused by the contraction of the temporalis, the masseter, and the medial pterygoid muscles. Let's look at the nerve supply as well as the blood supply to this joint. The arterial blood supply to the TMJ is provided by the branches of the external carotid artery, mainly the superficial temporal branch. Other contributing branches include the deep auricular, the ascending pharyngeal, and the maxillary arteries. The nerve supply to this joint is by the auriculotemporal and the masseteric branch of the mandibular nerve. Let's look at the clinical relevance of this joint. Temporomandibular joint dislocation is one of the major clinical complications associated with this joint. A dislocation of the temporomandibular joint can occur through a blow to the side of the face, yawning, or taking a large bite. The head of the mandible slips out of the mandibular fossa and it is pulled anteriorly. The patient becomes unable to close their mouth. The facial and auriculotemporal nerves run close to the joint and can be damaged if the injury is high energy. Posterior dislocation of the TMJ are possible, but they are very rare, requiring a large amount of force to overcome the postglenoid tubercle and strong intrinsic lateral ligament. Don't forget to subscribe. See you next time.